Welcome to the Salmon Runs YouTube. Enjoy the video.
Start by looking carefully at the injured foot and the surrounding area. Check for open wounds, deformities, severe pain, or inability to bear weight. Gently compare with the uninjured foot to spot asymmetry or obvious deformity. Measure swelling and raise the foot 6 inches above heart level to reduce swelling. Note any numbness or absent pulses, as these are warning signs. If bleeding soaks through bandages or bone is exposed, seek urgent care immediately. Begin immediate care by controlling bleeding and reducing swelling in a calm manner. Apply ice for 20 minutes every 2 hours during the first 48 hours to reduce pain and inflammation. Use a clean dressing for wounds and apply a compression wrap with moderate pressure to limit swelling without cutting circulation. Keep the foot elevated on pillows while resting to ease pain and reduce swelling. Avoid weight bearing until evaluation rules out fracture or serious ligament injury. Decide quickly whether professional evaluation is necessary based on symptoms and response. See a clinician for severe pain, inability to walk, numbness, or suspected fracture. Expect imaging like X-ray when there is deformity, persistent swelling after 48 hours, or localized bone tenderness. Follow instructions for immobilization with splint or boot if provided by your clinician. Ask about a rehabilitation plan and follow prescribed.
Thanks for watching. Consider subscribing if we helped you.